welcome. Thank you so much for joining today's Aligned Modern Health Digital Doc conversation on natural hormone balancing. We are joined by Aligned Modern Health functional medicine physician, Dr. Ioana Manahilova, and licensed acupuncturist, Renee Lytle. Before we get started, we like to just briefly introduce Aligned Modern Health in case this is your first time joining one of our Digital Doc webinars. Aligned Modern Health is Chicagoland's top-rated health and wellness service provider, offering support for the whole body, both internally and externally. We really aim to get to the root cause of why our patients are feeling what they're feeling, and not just focusing on one siloed symptom or condition. We take an integrative approach to medicine, meaning our expert providers work with each other to maximize the outcomes of our patients' treatment plans. Our 18 clinics in the Chicagoland area are supported by several different services, including physical medicine, which includes chiropractic care, injury prevention and injury rehabilitation, athletic performance support, and clinical massage therapy. We offer acupuncture in each of our clinics, which is amazing to benefit physical pain symptoms, but also some intangibles like stress, anxiety, depression, sleeplessness and insomnia, seasonal allergy support, men's and women's health concerns, and of course, hormone balancing. We have a nationally recognized fertility and conception support program. We also offer some other modalities under the traditional Chinese medicine umbrella, like herbal medicine, cupping, and moxibustion. We round out our services both in clinic and via telemedicine in several US states with our functional medicine and clinical nutrition practice. We like to say this is a great way to better understand why you're feeling what you're feeling externally by doing a deep dive diagnostic internally. We support a lot of gastrointestinal and autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, of course, food sensitivity testing, and nutritional counseling. We offer free 15-minute consults with our expert providers if any of this has piqued your interest and you'd prefer to ask some questions one-on-one. We also are in network with most major insurance providers and can offer a complimentary benefits check if you'd like to better understand what your insurance plan may cover. We encourage questions for today's conversation. We want you to get the most out of this conversation as possible, and so we invite you to type your questions anytime into the Q&A feature on Zoom. The Q&A icon is the one with the two little chat bubbles that says Q&A. Please feel free to type in your questions anytime, and we will take questions at the end of the conversation. All that said, it is my pleasure to welcome Dr. Ioana Manahilova.
Hi, everyone. My name is Dr. Ioana Manahilova. I am the functional medicine physician at both the Lincoln Park and Southport locations. I got my bachelor's of science in human physiology from the University of Iowa, go Hawks. I also got my doctorate at National University of Health Sciences right here in Lombard, and I do have postdoctoral studies in both functional medicine and functional neurology. My clinical passions include neurological concerns, whether it's Alzheimer's, cognitive impairment, post-traumatic brain injury, GI concerns such as IBS, SIBO, Candida, general food sensitivities. Additionally, some more general symptoms such as brain fog, hormone balancing, and fatigue.
Hey, I'm Renee Lytle. I'm a licensed acupuncturist here at Aligned Modern Health. I work with Dr. Manahilova here at the Southport Clinic. I hold a Master's of Science in Traditional Chinese Medicine from Midwest College here in Illinois. From there, I also got a Bachelor's of Science in Nutrition. A lot of what I treat includes a lot of what we're talking about today, hormone balancing in its various forms. I do a lot of women's health, a lot of digestive stuff, anxiety, stress, physical pain, and a very large part of my patient population is part of the LGBTQ community, as well as folks with neurodivergent conditions. Just to get us started, we'll talk a little bit about what acupuncture is, how it works, and then we'll kick it over to you in a second. Acupuncture is really focused on balancing the various systems of your body to return to homeostasis so that the symptoms that you're experiencing are relieved. We do that by having a thorough exam. The first visit, we talk about everything that's going on from head to toe to really get a look at what is going on, big picture, the root of the symptoms that you're experiencing, things that you might not feel are related to the things that brought you in. From our perspective, usually are. From a more technical point, the microtrauma created by the insertion of the needles creates a histamine response within the body that causes your brain to release endorphins, other chemicals to help relieve pain, increase circulation. We're activating the immune system to decrease inflammation, as well as getting you into that parasympathetic nervous system, rest, digest, repair mode. Specifically, when we're talking hormone balancing, we're trying to affect the HPA axis, hypothalamic, pituitary, adrenal axis. We choose points based on that big picture, as well as the symptoms that specifically brought you in. That is likely going to change from visit to visit because the symptoms that you're experiencing usually changes in some fashion. We also utilize a lot of accessory modalities, including electrostimulation, cupping, gua sha, tuina, Chinese medical massage, moxibustion. Moxa is an herb that we burn around various parts of the body, and Chinese herbal formulas where appropriate. Do you want to tell us a little bit about functional medicine?
Sure, Renee, thank you so much for that excellent introduction to acupuncturists and for being my very own acupuncturist. I have personally gotten all of those treatments and they are absolutely phenomenal. As far as functional medicine and how we relate it to hormone balance, we take the first exam to really get to know your health history. We do an in-depth physical exam, and then we focus on doing a very comprehensive testing panel, whether that's going to include blood work, which is typically covered by all insurances. Then we move on to other functional testing modalities. For example, if it's a more GI concern, we have stool testing. We also have hormone testing that goes far and wide beyond what general blood work can show us. After that, we really focus on ensuring that your blood work makes sense. So I like to indicate that functional medicine really goes from generalization to personalization. So we focus on exploring those blood work results in a way that makes sense to you as the patient. And we also ensure that the diet, lifestyle, and supplement recommendations are really personalized to what we're seeing with not only the results, but as Renee had indicated, to your signs and symptoms. Those may change. So you may find that as we progress through your treatment plan, whether it's functional medicine only, functional medicine with acupuncture, or all of our modalities combined, you may notice that all of them will be personalized to each visit depending on how you're feeling at that time. Outside of in-house referrals, we also work with other specialties. Most commonly, as Renee had mentioned, we work with the fertility specialists around Chicago area. We also work with GI specialists, OBGYN, endocrinologists, and even primary care physicians to ensure that you are getting the most comprehensive care, especially as it relates to hormone health, because as we all know, hormones can be extremely tricky. So starting with our hormone balancing, I really like to start with cortisol. It is our jack of all trades hormone. It helps with blood pressure maintenance, the sleep-wake cycle, blood sugar regulation. It helps you have good energy levels. And if it's not in balance, you may find that you have things such as fatigue. It also regulates how your body uses fats, proteins, and carbs. So while you are what you eat, you may also notice that stress can impact how you feel on a day-to-day basis. Some signs of cortisol imbalance include symptoms such as dizziness, low blood pressure, nausea, vomiting, salt cravings, weight loss, or weight gain, especially around the abdomen, psychological symptoms such as depression and anxiety, and then also weakness in some of your muscles, because as we indicated, cortisol does help you regulate not only fats, but proteins and carbs. When we think about cortisol, we also want to make sure that while cortisol is in balance, we need to make sure melatonin is in balance as well. Cortisol and melatonin are inversely related. So while cortisol keeps you up during the day, melatonin is responsible for helping you fall asleep during the night. So those are some of the two most common hormones that we take a look at. From a cortisol perspective, we can utilize blood work, we can utilize a 4-point cortisol test, and that test actually provides us with a large picture of your cortisol, not just in that point in time, but as you progress throughout your day. As a provider, I use that 4-point cortisol test to really personalize the treatment plan. So if you find that for you, cortisol or stress seems to, for whatever reason, be higher at 3 p.m., we might do some specific supplementation, diet, or lifestyle changes around that time to ensure that we are getting your cortisol levels back down so that as you get closer to that nighttime, you're able to fall asleep faster. Renee, how would you say that acupuncture focuses on our jack of all trades hormone cortisol?
I definitely see a lot of the same things. More often, I find that people come in with sleep issues. You don't sleep well, and everything else kind of falls apart. Anxiety gets worse. You just feel more amped up. So acupuncture is definitely focusing on the relaxation, especially in that moment. Sometimes patients find that relaxation is hard. It's not some innate thing that we all know how to do. It's a practice learned skill. And sometimes just coming in for an hour dedicated to just laying there and being present and relaxing is really important for them.
Yeah, you said kind of exactly what I was thinking. I myself go to acupuncture just for that purpose alone, because for that 1 hour, I really get to focus on myself and my stress response. As you also hit another really good key point, we always ask about sleep, both in functional medicine and, as you mentioned, in acupuncture. Do you have difficulty falling asleep, staying asleep, or even do you wake up feeling well rested? Recent research actually just highlighted that 1 night of interrupted sleep can put you in a pre-diabetic state, which again, cortisol being the jack of all trades hormone, that directly correlates to why that could be occurring. Another one of our most common hormone issues that we often see are the sex hormones. So when we think about people assigned female at birth, we think about estrogen. It is extremely important for our balance as a whole. Signs of estrogen imbalance can be fatigue, hot flashes, increased sweating, vaginal dryness, again, weight gain. So now you start to notice that even with cortisol and estrogen, there are similarities in the way that they can present, which is why with functional medicine, we really focus on the personalization aspect and explore all hormones that could be impacted, not just the one. We also think about testosterone for people assigned male at birth, because that can lead to symptoms such as erectile dysfunction, again, fatigue, loss of muscle mass, low libido, and increased abdominal weight gain. We also take a look at testosterone and estrogen as a combination and how they relate to each other, especially for females. We know that as you progress through your cycle, estrogen changes, as does testosterone and all of our other sex hormones, in response to whether we're in the first half of our cycle in that follicular phase, whether we're in ovulation, or in that second half of our cycle, the luteal phase. How would you say acupuncture focuses on sex hormones?
Oh, there's a lot of different things that we focus on with sex hormones. Fertility, infertility, folks going through IVF, be that the male partner or the female partner. Supporting natural fertility, menstrual cycle issues. Are we talking painful periods, dysmenorrhea, amenorrhea, PMS symptoms, PMDD symptoms, perimenopause, menopause symptoms, postpartum. Also trans non-binary folks that are using hormones. Sometimes we are able to help kind of mitigate some of those side effects that you would expect to be seeing with that. This is definitely something that takes a little bit longer. When we're talking menstrual cycle issues, I'm definitely expecting to see people over several cycles. Most people see changes within that first cycle, but it definitely takes a while to even things out. How about you?
I absolutely agree with that there. Definitely, when we think about hormone balance, it does take a little bit than just overnight. Like you mentioned, we do see a change in that first cycle. However, those changes continue into the second, third cycle and beyond. Another thing that you really mentioned is fertility. I myself personally see a lot of couples for fertility. You mentioned that it could be both partners, and we want to make sure that we are addressing both sides of that equation. I also see a lot of PCOS and PMDD patients, whether it is a response to, more hormone balance, more insulin, which we'll talk about in just a little bit here, but we take a look at all of the different factors as it relates to whatever diagnosis it is with hormone balancing. And one of the other things that we really focus on is pre, during, and postnatal. We want to make sure that our patients are really getting the care that they need throughout the entire process, especially that 3-month postnatal. We do see a lot of patients come in, both myself and Renee. We actually share a lot of those patients postnatal, where they see a lot of changes that previously had not been in their bodies before, where they had been able to, lose the weight or go back to having full energy. That's not necessarily the case after even maybe first, second, third kid. It just all depends on what's occurring during that pregnancy itself. We also really focus on postmenopausal support. We want to make sure that as our aging population goes through these changes, they continue to have a high quality of life and are able to do all of their activities of daily living. Another way that I really utilize acupuncture in my practice is for patients who are either getting off of birth control or wanting to go on a different form of birth control. I know Renee and I have a lot of patients that we help with from different perspectives to ensure that they're getting that whole health comprehensive care as it relates to their sex hormones and all the different changes that occur during that time. Another common hormone that we work with is your thyroid hormone, right? That is responsible for controlling your body's metabolism. So essentially, they help transform the food we eat into energy. That means that they impact essentially every part of your body. And again, why we really look at focusing on, making medicine less generalized and more personalized. Symptoms of hypothyroidism or underactive thyroid include things such as cold intolerance, constipation. So that's where we really see that tie in with gut health, dry skin, excessive weight gain, again, especially around the abdomen, fatigue. As you've noticed, we've mentioned fatigue with almost every hormone we've talked about, and hair loss, including on the outer third of your eyebrows. With hyperthyroidism, we see the opposite. We see increased sweating, jitteriness, loose bowel movements, heart palpitations, and weight loss. So with thyroid health, this is where I really start to become, I feel like, a medical detective, in that we really want to focus on making sure that we are finding the root driver of what's causing thyroid imbalance, or where your thyroid imbalance is causing some signs and symptoms in different systems in your body. How about with you, Renee?
Absolutely. I ask, especially my fertility patients, or patients that are just coming in for weight management, energy management, if they've had their thyroid evaluated. And that's definitely one of the first things I ask. And if they haven't, certainly sending them right your way.
We do a very comprehensive blood workup for thyroid panels right outside of the general TSH. We really make sure that we are looking at all the systems that thyroid can impact, and also the thyroid hormones themselves, whether it's active, inactive form of thyroid hormone, the antibodies themselves. We really make sure that that is fully addressed, especially if you are coming in with concerns that relate to thyroid issues. That brings us into insulin. Insulin is responsible for also helping us with conversion of glucose into energy. So again, another way in thyroid and insulin having some overlapping issues that they may help with, but we do see that signs of an insulin imbalance can indicate increased thirst, weight loss, high blood sugar, And we really want to make sure that we are catching these things, because blood sugar can be extremely detrimental to health if it's really low. And over time, with things such as type 2 diabetes, prediabetes, metabolic syndrome, we do see that those first stages of disease can bring about more severe complications, such as heart disease or various other forms of metabolic breakdown. Renee, would you see that you often see insulin sensitivity in your patients?
For sure. I definitely have a few right now that are struggling with that, and they've been using acupuncture definitely to combat some of the side effects of some of the medications they're on, to help keep their blood sugar more level, less peaks, less crashes. It's certainly not a replacement for insulin or the medications, but it's certainly helping them feel better, less anxiety with the discomfort, less digestive concerns, for sure.
Yeah, absolutely. And I think you made another really good point there with, we work a lot with the current providers and current team that you have in place to make sure that we're a great adjuvant to the practices that you already have in place. So if you are already on an insulin for whether type 1 or type 2 diabetes, we really help to focus on what we can help do to increase quality of life. Like you mentioned, decreasing anxiety, or making sure that we are addressing those dietary concerns when it comes to insulin resistance and blood sugar stability. We utilize our nutrition services very often to make sure that patients know how to eat that's right for them. There's a lot of different research out there for a lot of really good dietary changes that we can instill. But again, it all comes down to personalization of that program, depending on the blood work panel that we're seeing for you, the patient. So we might enact one dietary change for a patient, but we might enact a different change depending on, and even if it's just one shift in blood sugar markers, it could make all the difference in how we utilize that nutrition plan. This brings me to a conversation about something that Renee and I often do. We combine all of these different components of hormone health into brain health. So I like to say that I practice functional medicine with your brain and mind, having that background in neurology as well. And I'm going to kick it to Renee as we have a fascinating case study that combines both hormone health and brain health.
Oh yeah, absolutely. A lot of times my patients, assigned female at birth, that tend to present with hormone issues around their period. There's definitely an overlap with those folks having a neurodivergent condition, ADHD especially, that spike in estrogen, and then that dramatic drop, and then that spike in progesterone between ovulation and right before their period. They definitely notice more brain fog, difficulty concentrating, executive function issues, as well as the PMS symptoms. And we definitely utilize acupuncture generally before they expect to feel those symptoms to really help even things out.
Yeah, and again, making all the good points at this webinar, Renee, we focus on making sure that we personalize your treatment plan, because generally most people, I know none of my patients come in for just one complaint, right? There's a lot of complexity with cases, especially as it relates to neurodivergent conditions. As you mentioned, ADHD, OCD, those can really impact activities of daily living, and day-to-day things can be really different. You could have a really good day, you can have a really bad day. So we utilize a lot of the testing out there to try and figure out exactly what is going on in your body at that time. We have neurotransmitter testing that we utilize in conjunction with the hormone testing. And if we even need to utilize gut testing, we do bring all of it together. As far as hormones go, for me, it is definitely something that I look at with a fine-tooth comb, because so many hormones, especially the ones that we talked today about, can present so similarly. So a lot of them, we mentioned fatigue, right? When a patient comes in for fatigue, even if that's their only complaint, I know that that's going to be a lot of comprehensive workup to make sure we are finding the driver of that fatigue, whether it is hormone imbalance, whether it is more nutrient deficiency, or whether it is something entirely altogether. It is up to us as providers to really make sure that we work together at Aligned Modern Health and with your current healthcare team to ensure we're finding what is driving you to come see us in the first place.
I think we're about ready for questions.
Fantastic. Questions are streaming in here. While we bring up our slide again to kind of bring the presentation to a close, we have a lot of questions around menopause, questions about if folks have started kind of external support for menopause and hormone control. Can functional medicine or acupuncture help wean off those pharmaceuticals? How can folks balance hormones during the different stages of menopause? A lot of menopause-based questions. If maybe Dr. Monahilova, you can start, and then Renee, you can provide your acupuncture insights as well.
Sure. So I have a combination of patients that are either on bioidentical hormone replacement therapy already, and I really help to adjuvant in additional symptoms that they may have as a response to starting or finding the right dosing for them. So we really make sure that we are testing and retesting during that time to ensure that their hormone levels even out. I also have patients that want to use complementary medicine only, and that's where we really do that more deep dive into hormone testing, not just the hormone themselves, but we now have testing that actually shows us the way that you metabolize hormones and the nutrients that you need to ensure that you are getting that proper hormone production. So those are two of the ways that I really help support my menopausal patients in trying to make sure that they're getting the nutrients they need for whatever it is that's showing up in their blood work, and also finding out how they metabolize their hormones, because that's just as important as how well they're able to make and balance those hormones.
From an acupuncture perspective, we definitely can support the symptoms of menopause with acupuncture as well as Chinese herbal medicine. However, if you are looking to get completely off whatever medication you are on, I would certainly recommend co-treating with functional medicine for all of the reasons Dr. Monahilova just listed.
Thank you so much. We have a number of questions about testing. I'm going to address just a little bit of the kind of practical, technical part, and then we have some questions that may better be answered by our experts. One of the questions is kind of about insurance and how we go about that. A lot of blood work and phlebotomy services are covered by most major insurance providers. However, any specialty testing outside of general phlebotomy work are considered specialty tests, and they are not covered by insurance. This is not an Aligned Modern Health rule. This is kind of a federal insurance regulation. And if you have questions about the costs or what's included in certain tests, we encourage you to schedule a free 15-minute consultation where we can answer that specific to you and your goals and your needs to get you the information that you're looking for. There are so many different tests available. It would be inappropriate to go over all of them on a public webinar like this, but we absolutely want you to get the information that you're looking for. So you can give us a call at 773-692-6700 or visit us online at alignedmodernhealth.com if you'd like to schedule that free consult to learn more. Dr. Monahilova, you mentioned how some of our testing and blood work is more comprehensive and a little bit different than some traditional workups that you might get from a GP. Can you talk about that just a little bit and tell us how Aligned Modern Health might interpret those results differently?
Sure. So outside of that general panel that we're used to, that, comprehensive metabolic panel, that complete blood count, and maybe a TSH, which tests for just generalized thyroid health, we really dig a little bit deeper. So we do blood sugar testing, we do insulin, we do a number of different tests that help us show your blood sugar stability throughout the day. We do inflammatory panels where they are required. We look at not just systemic inflammation, but joint inflammation. We also look at tissue inflammation. All of those are different tests, present differently, and have different treatment plans. We also look at micronutrients. We find that vitamin D is a very common vitamin deficiency. We also find magnesium could be a deficiency, copper. So we really, again, dig deeper. And the reason that we highlight those micronutrients is because they act as cofactors in our ability to make certain hormones, to be able to have better energy production. And we want to also make sure that we are doing that comprehensive panel to really encompass all of the different symptoms that you're coming in for. So that's where that more specialty testing comes in. Janine asked a really great question in how we interpret labs a little bit more differently. We look at the optimal ranges depending on age, gender, signs and symptoms, other comorbidities or diseases that you might have. And we try to get you within those lines to, again, make sure we're optimizing your health and ensuring that you can have that better quality of life and live through those activities of daily living with less pain, with less peaks and valleys, less hormone imbalances, and less blood sugar stability or instability.
Thank you so much. This question I'd love to start with Renee and then also hear the FM answer as well. When it comes to certain PMS symptoms like night sweats and sleep disturbances, can acupuncture help? Are there supplements? Are there lifestyle changes that can help? Kind of how would the different approaches approach those symptoms?
Absolutely. I see patients with night sweats all the time. If it's perimenopause, menopause, it could be just hormone regulation. Aside from those, postpartum, there's a lot of night sweats there. Acupuncture has some really great points and herbal formulas that can really help those.
As far as functional medicine, sleep is one of the most common issues that I see my patients come in for. And so we really take a deeper dive into whether it's an ability to fall asleep, whether it's an inability to stay asleep, or whether it is just simply that you do not feel well rested when you wake up. All of the testing for that is a little bit different and indicates different hormonal imbalances during that time. So again, we take that finer lens and make sure that we're looking at different systems that play into how well you're sleeping and whether or not you're actually getting quality sleep, which is just as important as how long you're sleeping. I always recommend books or podcasts or blogs or videos for my patients. And a great book that I love by Matthew Walker called Why We Sleep starts answering a lot of the sleep related questions. Now, again, it is more generalized. So while you'll get some good diet, lifestyle, supplement recommendations from that book, everyone is a little bit different. Sleep is one of the more nuanced aspects of health. And that's where we really come in with the specialty testing that we have, especially neurotransmitter testing, cortisol testing, melatonin testing, to make sure that your levels look ideal for you to be able to fall asleep, stay asleep, and wake up feeling well rested.
Thank you. What it sounds like to me, and please corroborate or correct me, it kind of sounds like for all of these different symptoms, if you're not sure what's causing them or kind of where you are in your different stages of hormone life over the years, functional medicine can be a great tool to help diagnose and understand. And whereas acupuncture can be really amazing to treat the symptoms. So when you are experiencing symptoms, especially if you already know kind of, why they're happening based on your stage of life or different testing that you may have already gone through, acupuncture can be really amazing in helping to alleviate and transition those symptoms into something that's a little bit more palatable over time. Would that be fair?
That is, you hit the nail on the head with that one.
Mm-hmm. Acupuncture also, if you are kind of in that aging population that is expecting those symptoms to start creeping in, you can definitely use it prophylactically, not just once the symptoms are already here. In Chinese medicine, it is a commonly held belief that aging shouldn't be full of those symptoms. Reproductive health in general shouldn't be painful. It shouldn't be uncomfortable. It should be no big deal.
That is a great point, Renee. Thank you so much for bringing up the proactive approach to healthcare. A lot of times, especially in the US, we're very reactive to our symptoms and conditions. And I really appreciate that you brought up the idea of being proactive about your care as well. We have time for just a few more questions, but we do have a lot of great questions here that we may not all get to. I please do encourage you to give us a call or schedule a free consult if we haven't gotten to all of your questions, but we have dozens more here in just a few more moments. So thank you for asking them, and we just want to be respectful of everybody's time. How would any of your comments to date or to this point change for women that may have had a whole or partial hysterectomy, if at all?
Oh, sure. I have a lot of patients actually that have that specific issue. And we basically, again, use that more specialty testing to find what the repercussions of that specific surgery are. My comments wouldn't necessarily change. I really honestly think that there's 4 pillars of health. You need to eat well, sleep well, you need to be able to produce your energy, and then you need to be able to breathe well. And so if you are able to do all 4 of those things, generally most of us tend to be a lot better off in terms of activities of daily living and quality of life. And so while it's a little bit more complex, it's well within our wheelhouse to be able to find the right supplementation, diet, and lifestyle changes to ensure that we are taking into account that additional hysterectomy.
Renee, is there anything that you'd like to add from the Chinese medicine approach?
No, not really. One of the really special things to me about Chinese medicine is that it's not one way to treat any one condition. So just because that is your experience doesn't mean that I'm going to treat your experience the same as the next 5 women that also have that same experience. So generally, we are looking at you from a whole body approach. So the comments pretty much stay the same.
Thank you so much. Again, we do have a lot of great questions here that we aren't going to be able to answer. We will do our best to reach out to anybody that does have questions that have gone unanswered, but please do feel free to contact us for more information as well. This does bring us to all of the time that we have for today. Renee, Dr. Manahilova, thank you so much for sharing your time and your talents and your wisdom. And to all of you that have joined us on the webinar, especially live, we appreciate your participation and your great questions. Thank you so much. Our next digital doc will be on September 14th, and that will be a conversation on seasonal allergies and some alternative ways to treat. We appreciate your time, and we look forward to seeing you again soon at the Aligned Modern Health Digital Doc webinar series. Cheers.